According to a team from Imperial College in London, attempts to control the outbreak are now pointless because authorities have missed the chance to prevent the disease exploding. It said that slowing the spread of the virus, which has already deterred dozens of athletes from taking part in next month's Rio Olympics, will simply delay the point at which it fizzles out naturally. The researchers predict the epidemic will end only when the population reaches a stage of herd immunity, where there are no longer enough uninfected people for transmission of the virus to be sustained. Using data modeling, the team predicts the next outbreak will take place in around 10 years. A number of organizations believe they are close to developing a vaccine to prevent infection against the current virus. However, the Imperial researchers say that by the time the drugs are ready for testing, the number of cases is likely to have substantially dropped, which will make trials difficult. The virus is carried by the Aedes aegypti mosquito. However, any large-scale programs to target the insects have had limited impact. Professor Neil Ferguson, lead author of the research, cautioned against pursuing. He added, in a worst-case scenario, Zika would become endemic in the Caribbean in the long term, which would mean smaller, frequent outbreaks. It is not known why Zika affected the region in such an explosive way starting last year. Some scientists believe the spread may have been aided by the climate, as it coincided with an El Niño event, a phenomenon associated with a band of warm water developing in the equatorial Pacific. Eugenia Peters, GBN News.